I was diagnosed with type 1 diabetes when I was 5 years old. I'm 13 now. I've had diabetes for more than half my life. It's not just about the finger pokes or counting carbohydrates. It's about the day-to-day choices. My insulin pump is my lifeline. It gives me the one thing my body lacks to survive. But it also does so much more for me, including letting me be just a kid.
I'm quite amazed at how disciplined Savannah is. She manages her diabetes so well and is so brave. It's not always easy as a parent, knowing that you can't afford the treatment that could improve your daughter's life so drastically. Insulin pumps cost $7,000 and are only warranted for 4 years. On top of this, diabetes supplies cost more than $2,500 a year. That cost prohibits kids like Savannah from truly experiencing their childhood. It makes parents like us concerned about how Savannah will have to live the rest of her life.
Diabetes holds me back from doing some things, but my pump loosens the tight grip diabetes has on my life choices. I still have my limits, just like other people, but my limits don't necessarily disappoint me anymore, thanks to my pump.
As parents, we are so proud of Savannah. She is thriving even with diabetes. She's a musician, an athlete, and a leader. Many things define certain parts of her life, and one of those categories is type 1 diabetes. For most of Savannah's childhood, diabetes has been a big part of who she is, and for all we know, it could be even a while longer before she can say she has a cure for this condition. It's hard to watch her grow up in this way, but we feel like the pump is the best way for Savannah to manage diabetes. Now she is helping other people, and we are just so grateful to live where we are supported and to have the reassurance that her pump will be there to support her as well.
Trying to recover from surgery, I would walk as much as possible, but every time I would go out to walk, I had extreme pain in my left big toe. I would complain about the pain to the nursing staff. However, the nurses could find nothing wrong with my toe. I repeatedly explained that the pain was not on the outside of my toe, but it was on the inside of my toe, and I remember them looking at me in disbelief with that look saying, "What are you talking about?" A friend of mine was helping to massage my foot to help me manage the pain, and she advised me that there was a really big callus on my left big toe. She began to pick at it for me, and the pain immediately began to ease up. She got to a point where she could pull the callus off, and I told her to do it. She took a firm grip, and she ripped that callus off, and oh, did it feel good. Then there was the realization that underneath the callus, there was an enormous infection. There was a foot ulcer. An entire hospital staff, a ward of people, did not know how to deal with my diabetic foot injury. They couldn't find it, and they didn't know how to treat it. My toes will never be the same. I now need to take extra good care of them every single day. The healed skin over where the ulcer once was is extremely fragile and is susceptible to breaking open when too much pressure is put on the foot. I still live, I still move, I still work, and I will deal with and live with the reoccurring damage to my toe for the rest of my life.
Prior to the DON-SCN Diabetes Foot Care Clinical Pathway Project, there were limited services to refer patients who were at risk of developing a diabetic foot ulcer. Foot screening amongst diabetes patients was not routine in primary care. With the implementation of the pathway at the Westview Primary Care Network, more of the healthcare providers are now routinely performing foot screens. The Westview High-Risk Foot Team now accepts referrals for patients at risk of an ulcer, whereas before the patient had to have an ulcer present. As a nurse in the primary care network, I have seen firsthand how foot screening and early intervention of proper foot care and footwear is making a difference in preventing diabetic ulcers. With the patient resources, patients are understanding their part in self-care and prevention. Working together will improve the lives of people with diabetes and save limbs.
My toes will never be the same, but with foot screening, I can manage them better than ever before. And with improved foot education in Alberta, I know we can prevent people from ever getting into this situation in the first place.
I was very confused and frustrated by the lack of concern when I experienced high blood sugars in hospital. My community healthcare team stressed the importance of good blood sugar control to prevent complications related to diabetes. Patients are afraid of high blood sugar, but the hospital staff did not seem to be concerned. I was treated as if I had no knowledge of how to manage my diabetes and no right to participate in my own care. The hospital staff took over and managed my blood sugar using sliding scale insulin. The reactive treatment plan seemed unnecessarily dangerous to my health, potentially exposing me to the many serious complications that result from poor blood sugar control. I lost my confidence in the hospital healthcare team's ability to manage my diabetes. The imprecise and reactive management of my blood sugar undermined the message that optimal blood sugar control is important, and their excluding me from helping with my own care stole my voice as a patient.
I had the opportunity to join the DON SCN Provincial Inpatient Diabetes Management Initiative in 2015. This multifaceted initiative is well thought out. The plan to improve glycemic management for the patients supported the nurses in their ability to provide safe patient diabetes care. The DON was able to coordinate the education of multiple health professionals to improve diabetes care across many sites and hospital departments. Feedback from my colleagues has been very positive with the support and education from the DON. Safety, confidence, and comfort with diabetes management has improved. This initiative just makes sense to me, and the inpatient medical nurses are embracing the change.
The DON SCN's focus on in-hospital management of diabetes has given me my voice back. They have listened to my concerns and worked to address them. Being part of this provincial initiative has transformed this negative experience into positive motivation, empowering me to help improve hospital conditions for other people with diabetes. Better blood sugar management in hospital will enable patients with diabetes to get home from hospital sooner and back to their regular activities.